Hey everyone, Maurice Goodwin here. This video is packed full of information about vocal fold nodules and belongs in a series of videos that are meant to educate about various voice disorders from the perspective of a speech pathologist. The disclaimer here is that I am one person coming from one perspective, and this is certainly not medical advice, but it is information that is meant to help you and other folks that you may know who struggle with voice problems. I am a speech-language pathologist that specializes in the areas of voice and upper airway disorders. 100% of my clinical work is working with people who have problems with their voice, and very frequently people who have been diagnosed with or currently working through vocal fold nodules. Vocal fold nodules are small, benign growths on the vocal folds or the edges of the vocal folds. Now, benign in this context means non-cancerous. They are not dangerous. However, vocal fold nodules often have a pretty big impact on the way that someone's able to use their voice and the quality of the sound that they're able to produce. Vocal fold nodules typically develop on the vocal fold as a result of voice use, whether that's prolonged use, loud use, shouting, sometimes even singing or kind of performance voice tasks can lead to greater irritation on the vocal folds, which causes vocal fold nodules, but we'll get into that in a moment. Understanding what vocal fold nodules are and how they're treated can be extremely helpful for making sure that the right care decisions are being made. So let's jump into it. You have two vocal folds, one on the left side, one on the right side. They sit horizontally in the neck. When you go to turn on your voice, your vocal folds come together and vibrate, and they vibrate pretty fast. So for higher voices, they typically vibrate around 160 to 200 times a second when you're speaking, and lower voices anywhere from 80 to 120 times a second. Now you may be thinking, that's a lot of vocal fold vibration, and it absolutely is. So in a conversation with friends at a restaurant, or a conversation with a family member on the telephone, your vocal folds are vibrating tens of thousands of times a minute. But your vocal folds aren't just vibrating, they're also touching each other. And it's because of that contact, over time that can cause irritation or swelling at the level of the vocal folds. Now, the difficulty with this is vocal fold swelling or irritation is a normal thing. It happens to a lot of us. If I were to go to a baseball or a football game and cheer very loudly, I may wake up the next day or even later that evening and notice that my voice is a bit irritated. It may change in quality. It feels heavy. I may even feel sore or fatigued. That's a normal response to the amount of pressure and work I just put my voice under. Vocal fold nodules develop because of chronic, ongoing irritation at the level of the vocal folds, frequently caused by and increased by the amount that we use our voice. So vocal fold nodules do not just start. You don't wake up one day with vocal fold nodules. Vocal fold nodules are the result of ongoing or chronic irritation as a result of the use of the voice. Vocal fold nodules themselves are almost like calluses that you would develop on your hand. So I am someone who works out and goes to the gym. Because of that, and because of gripping the bar and lifting weight, I have developed calluses or hard parts on the pad of my hand. Now, if I continue to work out and continue to irritate these calluses, they will become harder or more stiff in an effort to protect the tissue underneath them because they were tired of being raw after working out. Now, if I were to completely and very suddenly stop working out or stop lifting in the way that I'm doing, or maybe even start wearing lifting gloves, I may notice that the calluses either reduce in size or become smaller. Nodules are similar or the same. Often folks with vocal fold nodules will endorse a change in the quality of their voice, a change in the amount of effort it feels like it takes them to use their voice. We often hear that there is pain associated with voicing and that the muscles of their neck become tired faster. This change in voice quality comes from a change in the vocal folds themselves. Just like I had mentioned that your hand can develop calluses, when the nodules develop on the tissue of the vocal folds, it impacts or changes their ability to vibrate as efficiently as they did before. One of the big changes that it makes functionally or physiologically in the voice is that when the vocal folds come together, instead of closing completely and creating a straight, smooth seal, what we often get is what we call hourglass closure, where you get a gap in the back of the vocal folds and a gap in the front of the vocal folds. That hourglass closure pattern results in a leak or a loss of air. And to adjust for this, folks will often start straining or pushing with the muscles of their larynx to try and get the same amount of voice and power. This really starts off a cycle where someone who may have irritated vocal folds is having to push with the muscles of their voice, which results in more irritation, which results in more pushing, which results in more irritation. This can be really tough to get out of. So how do we diagnose vocal fold nodules? We diagnose vocal fold nodules similarly to any other problem with the voice. We use laryngoscopy and specifically stroboscopy, which helps us assess the vibratory characteristics of the vocal folds and really get the best picture of what's happening with the tissue. There's some characteristics of vocal fold nodules that help us know that they're vocal fold nodules and not something like a vocal fold polyp or a vocal fold cyst. Vocal fold nodules are bilateral lesions, so there's one on the left and one on the right. It's not possible to just have one vocal fold nodule. Vocal fold nodules are bilateral lesions of the vocal fold. Vocal fold nodules are almost always found at the midpoint of the vocal fold. So there's the posterior portion, the point where it makes contact, the anterior portion. The vocal fold nodule is almost always located at the midpoint, kind of in the striking zone is what we call it. And that's the period of highest impact stress when we're using our voice. So if you think about what vocal fold nodules are, they actually make a lot of sense, and it makes sense how they get developed. People have to use their voice a lot, and whether you consider yourself a professional voice user or not, many of us use vocal communication as our primary form of communication. Many of us have jobs that require us to use our voice to get the job done. So there are a few professions that we see this very frequently, and we see it in a lot of teachers or people who have to speak very loudly over a certain amount of space or to wrangle humans. We see this in call center employees and lawyers. We see this in performers and singers, not just because of the amount of voicing that they're doing to perform, but the many different styles, the character voices, the pitch of their voice, the loudness of their voice is going to contribute to the variables responsible for developing those vocal fold nodules at the point where your vocal folds are working the hardest. The great thing about an accurate diagnosis of vocal fold nodules is that vocal fold nodules are completely treatable. The first line of treatment for vocal fold nodules is voice therapy. Voice therapy is a type of treatment done by a speech language pathologist. Not every speech pathologist has experience working with voice disorders or folks with vocal fold nodules. However, you can often find a speech language pathologist that works alongside an ENT or an ear, nose, and throat doctor or a laryngologist who is able to treat vocal fold nodules. Surgical options or procedures with a physician are less common when it comes to treating vocal fold nodules, but can be an option to nodules that do not respond to therapy. One of the challenging things about working with vocal fold nodules is that there are usually so many different variables and factors responsible for how or why they developed in the first place. So taking a look at how much the voice is being used and what type of environment is the voice being used, how loudly is the voice being used, at what pitch is the voice being used, and then there are many other variables that can also impact the health or the tissue of the vocal fold. So taking a look at allergies, the presence or absence, the potential presence of reflux, other irritation to the level of the vocal folds caused by medication, and overall other systemic health considerations. One of the things that can be done to help avoid developing vocal fold nodules or to avoid the further progression of vocal fold nodules is to pay attention to two things. How does the voice sound and how does the voice feel? If the voice is starting to sound weak, breathy, airy, or strained, then what we want to do is respond just like we would to any other part of the body and allow it to rest. If the voice is starting to feel like we're having to put more effort, if we're starting to feel pain with use, if we're starting to notice fatigue faster than we normally would, that can also be a sign that what our body needs is a bit of rest and recovery time before we continue using our voice. Continuing to use our voice after we start to notice changes in the quality or notice changes in the feeling and the amount of effort it takes can certainly lead to development of vocal fold nodules. While vocal fold nodules are a common problem that happen with a voice, they are certainly not the only thing that can happen with a voice. If you're concerned about either the quality of your sound or the way that your voice feels, I'm going to encourage you to get an evaluation either by a voice specialized speech language pathologist or an ENT, ear, nose, and throat doctor, or a laryngologist. So once again, vocal fold nodules are a common problem in folks who use their voice a lot. Vocal fold nodules are callus-like developments on the edge of the vocal fold tissue, typically at the midpoint where the vocal folds are striking the hottest. Thankfully, vocal fold nodules respond to things like voice therapy, where the goal is to maximize the function of the voice and reduce any outside irritations or barriers to natural recovery. If you found this video helpful, consider leaving a comment, a like, or subscribing to the channel. Once again, this video belongs in a series of videos meant to educate you on various voice disorders from the perspective of a speech-language pathologist that practices in voice. Chat soon. Bye.